After the outbreak of cholera in Nigeria with over 1,000 cases in Lagos State, Dr. Stevenson Ojefo, the Director of Health Edo State, has confirmed Edo State free from cholera, as he claimed that so far no case has been recorded. Speaking to BTV News, Dr. Stevenson highlighted that strong surveillance systems in public health centers and other relevant institutions have been put in place to track suspected cases of cholera.
There is no cholera outbreak in Edo State. We've not recorded any case. Many states have recorded cases of cholera in Nigeria. As of today, we have about 30 states who has recorded one case or the other. We swing into action immediately by activating the Public Health Emergency Operations Center and alert all our health institutions on the outbreak.
He reaffirmed the commitment of the Obaseki-led government towards safeguarding the health of citizens in the state, especially in the midst of the cholera pandemic in Nigeria. Dr. Ojefo noted that the Ministry of Health is aware that Edo State is a transit point for many travelers in the state and proper measures have been put in place to safeguard our borders. He also stated that local government officials are working towards sensitizing people across the state.
The primary healthcare system in Edo State is very, very strong. So we have also reached out to the Edo State Primary Healthcare Emergency. We are in contact with the medical officer of health in all the local governments in the states, because the primary healthcare are directly under the leadership of the medical officer of health assigned to that local government. So we have educated them. They have swung into action. There is sensitization in all corners. Edo State is a transit center, we all know. You're going to the north, you pass through Edo State. You're going to the south, you pass through Edo State. You go to the east, you pass through Edo State. So anywhere you are going to, Edo State is a central point. We are not unaware of that. Based on that singular factor, we close our borders. When I mean close our borders, not that we close it for people coming in, but we monitor, those that are coming in, where they are presented from. Is there any history of travel?
He appealed to the people to take up proper health measures such as washing their hands, fruits, proper hygiene and environmental sanitation, which is necessary for these times.
We as individuals, we have a role to play. We have a role to play. We should watch what we eat. We should watch what we eat. Then we should keep hygiene. And we should keep our environment clean. So, environmental sanitation, hygiene, and we watch what we eat is very essential, most especially at this point in time.
Different persons commented on the personal safety measures they have adopted and also suggested ways by which the Nigerian government can prepare against future health pandemics.
But what I do basically in the house is, and even while I'm moving around, I ensure that my hands are clean. As you can see, I'm holding some notes. So before I eat anything or whatever, I ensure that my hands are properly washed and clean. So maybe every 3 hours, intermittently, I do wash my hands.
Government can up their game on sensitization. We don't have to wait for deaths to be recorded in Edo State before the Ministry of Health and the primary healthcare development agencies and the rest of them swing into action.
So far, over 20 death cases have been recorded in Nigeria since the outbreak of cholera. Faithful Okwokam reporting for BTV News.